In general, men resist seeking medical care, often throwing up barriers when treatment is really needed. So what are men's health motivators and the barriers? Dr. Brad Gill is a urologist for the Cleveland Clinic, and he has some advice. Good morning.
Good morning, Angie. How are you?
I'm very good. Thank you for being with us. Let's talk about the survey and the information, the results of that survey. Were you surprised by them?
Actually, not really. It's not much of a surprise to us urologists that guys are a little bashful when they come into the office to see us. Actually, what we learned from the survey is that about 80% of men would rather do household chores, like clean the bathroom, than come in to see one of us.
That's interesting. So what are the barriers men throw up? What are their concerns?
So three of the big ones that came up in our survey were really, a concern that something serious could be identified in their health, something that could be life-changing. And from that regard, we really encourage guys to come in, because if something is going on and you catch it early, it's very treatable. Another one is that guys didn't really want to hear that they had to lose weight or had to exercise more or had to eat better. Some of those things that involve taking better care of yourself. And then the last one was just being uncomfortable, really being bashful about talking about certain topics. And that's where, as a physician, it's our job to really help the patient feel comfortable and let them know that these are things we see and deal with every day.
Well, what are some of the things that the Cleveland Clinic in particular is doing to help men kind of prioritize their health?
Quite a few things. So we've really expanded our footprint out into the community with a number of family health centers. We have also taken on some programming. We've done a number of health fairs really to engage men in the community, not only doing some screenings like blood pressure and cholesterol, but also some education about things that are normal and things that they really should go see a doctor for.
What are some of the things we can do as a society and family members? We all have men we love in our family, to kind of encourage them to step up and take better care of themselves before it's too late.
Really just engage with men. So the number one motivator we saw for guys going in and seeking health care was being healthy and being able to take care of their loved ones. That was about 85% of guys who said that's the number one reason they would see a doctor. Research has also shown that men who engage with their significant others tend to have better health overall. So the first step is really engaging in a conversation with the guy to say, hey, go in, get checked out, make sure everything's okay, and really reassure them that if you do find something going on and you catch it on a screening before it becomes a problem, it's usually more treatable, and the odds of taking care of things are a lot better.
Doctor, where can our viewers go to learn more about the Mention It survey and find some more advice?
There's lots of great information at clevelandclinic.org/mentionit.
Thank you so much, Dr. Gill, for being with us.
Thank you, Angie.
And we'll be back with more Lifestyles right after this. Stay with us.